She's going backwards in time. She's had quite a few treatments. Why should we care about that? It scares our patients away from coming into our offices to get things done. So you can see the changes in her skin quality, her facial contour. My goal is to go backwards in time to be 21 again. Hi, Dr. Jessie Cheung here. I was just doing a keynote presentation on winning combinations for the best outcomes in regenerative aesthetics, and I was with my fellow speakers, the best minds in the business, and I would love to share with you what we talked about. So this is Madonna. She's still my queen. I'm not trying to be a hater over here, but we could see her evolution in media over the years. She had some good fillers, some probably surgical interventions, and she hit a speed bump a couple of years ago where she had very dramatic, drastic transformation. Why should we care about that? It scares our patients away from coming into our offices to get things done. So we want more natural, long-lasting approaches to avoid the dramatic changes that patients don't want to see. So what I'd like to address are the phenotypic features of aging with internal health. So as our patients age, lose their bone, their skeletal framework starts to shrink, they lose their muscles, they start to have fat changes in body composition, their skin thins. So with osteopenia, we're trying to replicate that bony structure with fillers and implants nowadays. The increase in bone density is greatest with growth hormone therapy, then testosterone, and then estrogen. I do this for my patients. Sarcopenia, which is the loss of muscle mass, decreases every year, 1% to 2%. We have machines now that will work on muscle mass and toning our muscles, but we know that studies show testosterone replacement therapy, growth hormone therapy helps to increase our lean muscle mass. Sex hormones and skin aging. We know that estrogen deprivation, menopause, is horrible for females on their skin quality. We have the thinning of the epidermis, the dermis, less hydration to the skin, results in dryness, wrinkles, sagging. When you add that estrogen back to the skin plumps right back up, patients look healthier. And what's interesting is there's a lot of menopausal skincare lines now, but they don't address the root cause of that collagen loss, which is the loss of estrogen. The statistic is the first 5 years of menopause, we're losing 30% of our collagen. Gets worse every year after that. So it's kind of an interesting statistic and it's necessary to address for our female patients. For men too, we know that loss of testosterone affects their skin health. There's a study that with a topical estrogen reductase inhibitor that showed that adding that hormone back into the skin, their wrinkles improved. So growth hormone decreases about 14% per decade after the age of 30. There's a lot of symptoms of somatopause, which is the loss of growth hormone. Patients complain of low energy, they're tired, they're not sleeping well, brains don't work as well, loss of libido. Outside complaints are complaining of their loss of muscle mass. They're sticking, they're sagging, their skin starts to thin. We like to replace it in our patients. So my approach is we have my progressive and aggressive treatments. So I like to start with the hormones and peptide therapy, which will help to improve the quality of their bones, their muscle mass, their fat and skin. And of course I have my treatments with the lasers, the fillers, the threads, the toxins, skin health. So we heard Dr. Cheung talk about the skin booster infusion, the dermal electroporation device. Well, probably we'll get into a couple slides, but there's a lot of ways to incorporate these skin boosters delivery into our patients. I don't like to inject them because there's bruising, there's swelling, there's pain. We like to deliver them with channeling or needling devices. We have a cryogenic device we have to use. We have energy-based devices that open channels in the skin with minimal downtime. Dermal electroporation, again, using electricity to open the channels in the skin. We can get molecules up to 2,000 kilodaltons into the skin in an aqueous solution. So we use lidocaine. We can put lidocaine to numb our patients better. Neurotoxins, deoxycholic acid, biologics like PRP and exosomes. We like to put peptides in, NAD, BPC. These will help with collagen generation. This is our device. It's a little bit more digital version of the DEP device. But in our clinic, we like to have a cocktail that includes hyaluronic acid for instant plumping and firming, and also brighteners, glutathione, tranexamic acid. We love the microbotulinum toxin to help to give the poreless skin effect. We have biostimulators with the polyribonucleotides, polylactic acid, calcium hydroxy acid. Low molecular weight hyaluronic acid has been shown to actually turn on your fibroblasts for collagen synthesis. Exosomes too. Intradermal neuromodulator, Dr. Cheung kind of covered that, but basically what happens is instead of targeting the deep muscles with your Botox, you're putting it more superficially to soften the superficial pull of these superficial muscles and also making the pores disappear and helping with sweat and sebum secretion. What we also know is there's increased glow in the skin because we have fluid retention in the dermis from relaxing the lymphatic muscle muscles. So this is our cryogenic delivery device. It's called the Target Cool. It's actually in one of the booths here. So this is carbon dioxide that freezes and freezes whatever you're trying to deliver the booster, microdroplets into the skin. And what we see with studies with that is you're getting actually penetration to the epidermis. And when you add this device to another delivery, such as microneedling, you're getting a synergistic effect, even deeper delivery with more penetration. It also has a carboxytherapy effect. So that will decrease inflammation, increase circulation, and actually increase more new blood vessels, the angiogenesis effect. So this is a before, and all my patients are actually on, all the pictures I'm going to show, they're all on hormones or peptide therapy. So she's young, this is her after skin booster treatment with a microroller infusion. So she had a combination of some hyaluronic acid, some brighteners, and this is her 4 weeks later with no filler, no threads, no laser. You see her skin actually looks firmer, plumper, and toned. And this is what treatment looks like with a micro-roller. You can see it's pretty painless. She looks very normal immediately after an infusion. And this is an example of skin booster delivery with a heat device, radiofrequency microneedling. This patient had hyaluronic acid, some brighteners, some polyribonucleotides, and this is her 4 weeks later with no makeup. You can see the improvements in her skin quality, especially around her eyes. Her skin looks firmer, smoother, more toned. This is radiofrequency microneedling delivery. So you can see you can get up to the edges of a lash line with this device, and we're making these little holes in the skin, and we're delivering the boosters on top right afterwards. So let's get to some case studies now of combination therapy. This is one of my favorite patients. He came to me age 71. He's a widower, so he was looking back to get into the dating game, and before he came to see me, he had a $6,000 facelift. He came in 4 weeks after the facelift. He was very embarrassed with how hollow he looked. He was skeletonized from the procedure. We did some fillers. We did some calcium hydroxylapatite for volume, but also for biostimulation for skin quality. This is him 3 months later after one treatment with 5 syringes. This is him 33 months after his first time he saw me. What did we do in between? 33 months later. I did a lot of stuff to him. So he's had a lot of volumization with fillers. He's had some biostimulators. He's had some PMMA, some Renuva. We did some thread lifting to him. We did some energy heat-based devices, some skin boosters. He's had a lot of treatments, but the goal for him was to look good naturally, subtly, not that dramatic, surgical difference. He did not like his surgery. And this is interesting. So after his Renuva treatment, he actually got sick with some GI issue, was hospitalized, lost 15 pounds in like 1 week. Came in to see me after that 15-pound rapid weight loss. That's that middle photo right over here. And then, so 6 months later, this is his after. What I do in between, I gave him some more volumization with calcium hydroxylapatite and hyaluronic acid, some biostimulator treatments too, PDO thread lift, and also more treatments with heat devices with boosters and microtoxin. He's a pretty happy camper. He is on DHEA, which is a testosterone precursor to help with his skin quality. This is another case study. She is a patient I met years ago. She had a facelift, and after using my treatments in her 3 years later, you can see the improvements in her skin quality and contour. And so before I met her, she had the facelift. She had some PLLA injections to her temples and cheeks and some stuff to the nose and lips. The past 3 years, I've done more volumization with fillers, some biostimulators. She's had some laser energy devices, PRX, which is biorevitalization, almost like a peel that doesn't peel you. More booster deliveries and neuromodulators. She is on topical estriol, which is great for skin quality in patients who are menopausal. And treatment since I last saw her, she's had some more volume with PLLA and more skin booster infusions to maintain her skin quality. Another case study, patient came to see me age 51. This is her 81 weeks after the first time I met her, after her first treatment. You can see improvements in her skin quality and also her contour. She's had filler, these are the treatments we've done to her. So we've done quite a bit of filler to her face, nose, forehead, jawline. She's had a lot of energy devices, thread lifts even, smooth threads for collagen stimulation. She's had a regular neuromodulator, a lot of skin booster infusions. What patients love about that is it's instant gratification with that HA for firming and glow, but also long-term collagen synthesis. This is her last photo here. I saw her right before we did another session of hyperdilute kaha with mixed boosters. I've been liking the combination of mixing the boosters with my calcium hydroxylapatite at the same time, and it does help to augment the results. So another patient, age 71, the first time I met her. In the middle, this is her 7 years later. She's going backwards in time. She's had quite a few treatments. She's had hormones, peptides, toxins, filler, thread lifting, energy-based devices. She's been loving her microinfusions to maintain her skin quality. Another case study, this is another patient who's on everything. Age 47 and age 54, so that is 7 years later. She's going backwards in time. So you can see the changes in her skin quality, her facial contour. And this is me. So this is, 2016, after having my kids and all the havoc they become in your skin and your body, I been getting Botox and fillers for years before this. So in the middle, this is me 6 months after my first ultrasound skin lifting treatment. No interventions besides that device. And this is me about a year later with more fillers, more botulinum toxin. And here we go. This is me 2 years ago till now. So August 2022, or a couple months ago. In between, I've had some fillers, some thread lifting, always keeping up with my lasers, my skin boosters, skincare always. Look at the difference from 8 years ago. My goal is to go backwards in time to be 21 again, but I don't know if I can get there, right? But yeah, so I practice what I preach. I'm a huge believer of working on my hormones, my peptides, and adding all the non-invasive procedures to keep me looking youthful but natural. And so this again, before and after, 8 years, about almost 8 years to the day, lots of treatments, but try to just, avoid the knife. And so to summarize, what do I think? How do you create a patient for life? I think you gotta give your patients what they want, but also give them what they don't know they need. And that's really working on their internal health, get the results of the treatments we're doing. Otherwise, it's a losing battle against time. So thank you very much. I will turn it over to